welcome to The Explainer. Today, we are tackling a massive, industry-wide operational bottleneck that is, quite frankly, quietly suffocating patient communication right now. We're going to look at exactly how artificial intelligence is stepping in to solve this crisis and how it's moving from basic, lab experimentation right into the hardcore operational infrastructure of real clinics. Let's get right into it.
Okay, let's dive into this. Picture this exact scenario. It's 9 p.m., you've just realized you have a super simple question about a brand new medication, and you decide to call your clinic. What happens next? Well, you get completely lost in an endless robotic phone maze. You hit 1 for this, 3 for that, navigating 6 different menu levels only to hit a dead-end voicemail. And when you inevitably call back the next morning, you have to repeat your entire life story to 3 different staff members. It's incredibly frustrating, right? And honestly, it completely chips away at the trust you have in your healthcare provider.
To understand how we actually fix this, here is our roadmap for today. We'll start with the communication bottleneck, define AI voice agents, look at the compliance architecture, peek inside AI triage engines, review some real-world clinic results, and finish with the future of care.
Section 1. The communication bottleneck, the symptom. If we treat this entire communication breakdown like a critical patient condition, we first have to diagnose the symptom.
And that symptom is severe administrative overload. Look at these specific pain points. Front desk teams are literally drowning in thousands of routine calls every single week. Appointment scheduling, prescription refills, basic insurance checks, you name it. Because of this massive bottleneck, physicians themselves are spending an astonishing 15.6 hours per week just on administrative duties. That is practically 2 full clinical days completely lost to paperwork. Plus, manual data entry errors from tired, overwhelmed staff contribute to a jaw-dropping $10.6 billion wasted annually just arguing over claims that should have been paid from the start. It's a total recipe for staff burnout and patient frustration.
Moving to Section 2, defining AI voice agents, the diagnosis and treatment. So what exactly is the cure here? Advanced, production-grade AI voice agents.
We really have to draw a sharp contrast here. Traditional interactive voice response, or IVR systems, are those rigid, clunky phone trees we all absolutely dread. They force you to say a keyword or press numbers just to navigate a menu, usually leading to a frustrating dead end. AI voice agents, on the other hand, are totally fluid, autonomous, and conversational. They don't just route your call. They actually conduct natural back-and-forth spoken conversations to complete end-to-end transactions, like scheduling or refills, without a human ever needing to intervene.
Now, what's really interesting about this slide is how these agents don't just respond, right? They act. They use 4 integrated technical layers in real time. First up, automatic speech recognition instantly converts the patient's speech to text, with incredibly high accuracy even for tricky medical terms. Second, natural language understanding interprets that text to grab the actual intent, like knowing that a refill request means it needs to go check a prescription record. Third, dialogue management and action executes the task by connecting straight to scheduling or records. And finally, text-to-speech converts the system's response back into a natural-sounding human voice. And the craziest part? This all happens in milliseconds.
Section 3. The compliance architecture, the guardrails. This is where we hit a massive reality check, because you absolutely cannot just plug a generic chatbot into a medical practice. Look, handling patient conversations means interacting with highly sensitive medical data. The difference between a standard customer service bot and a production-grade healthcare agent is just enormous. A viable platform must have absolutely non-negotiable compliance guardrails. We're talking the safe encrypted transmission of protected health information, or PHI. It requires legally binding business associate agreements, BAAs, between vendors and providers. It needs bidirectional integration with electronic health records, meaning the AI can both securely read and write data. Without these strict access controls and encrypted recordings, an AI system simply cannot survive in a regulated healthcare space. Section 4. Inside AI triage engines. Let's visualize the engine and guide you right into the operational brain of the system.
And this brilliantly illustrates exactly how it's done in the real world. This is a peek under the hood from an implementation by Dr. Patrick Proctor over at the Heart South Cardiovascular Group. What you're looking at is a HIPAA-compliant session manager. Notice the exact logic where it extracts the urgency level and the category of the patient's query, without ever storing the raw, sensitive data. It actually uses a one-way hash to prevent anyone from recovering that PHI. It preserves the context so the AI understands what's going on, all while maintaining perfect, auditable regulatory compliance. It's pretty genius.
And the intelligence layer running on top of that is just fascinating. The AI isn't just chatting, it's making critical medical decisions. It uses deterministic triage decision trees based on established, validated nursing protocols. So for example, if a patient suddenly mentions acute symptoms like chest pain, the AI immediately flags it as high urgency and routes that caller directly to a human nurse. No messing around. It also uses dynamic hybrid AI model selection. This means it seamlessly switches between a lightweight, cheaper AI model for simple stuff like what are your hours and a highly advanced model for complex symptom reporting. It perfectly balances operational cost with absolute medical safety.
Section 5. Real-world clinic results, the outcome. Let's look at the hard data from actual clinical deployments to see if this tech actually lives up to the hype.
Let's move to and see how this builds a completely different operational reality for clinics. These are the before and after metrics from a 90-day deployment at that same Heart South Cardiovascular Group, which serves over 50,000 patients. Just look at that top metric. The average phone wait time plummeted from a completely unacceptable 32 minutes down to just 8 minutes. Routine inquiry calls that normally tie up the front desk dropped from 847 a day to just 229. And as a direct result of all this, patient satisfaction scores jumped from a 3.2 out of 5 to a 4.2 out of 5. Patients are finally feeling heard and they're getting served efficiently.
But honestly, this is the number that makes healthcare administrators literally stop in their tracks. 96%. That is the cost reduction per interaction at that clinic. By utilizing that dynamic AI routing we talked about earlier, the cost per interaction plummeted from $4.20 down to just 18 cents. I mean, that is an absolutely staggering return on investment.
And look, this isn't just an isolated case. Across the wider healthcare industry, we are seeing massive structural shifts. At some U.S. hospitals right now, AI agents are autonomously managing over 60% of all inbound scheduling calls. One oncology practice saw a 40% reduction in their administrative backlog just by automating prescription renewals and insurance verifications. And for clinic staff, just imagine coming in on Monday morning to an 82% reduction in after-hours messages waiting to be processed. By removing these crushing administrative burdens, human staff can finally do what they do best, focus their time and empathy on actual direct patient care.
Section 6. The future of care beyond the phone. Let's look at how this technology evolves from solving a simple bottleneck to proactively changing health outcomes. AI voice agents are rapidly shifting from acting as mere digital receptionists to becoming proactive care coordinators. Think about post-discharge follow-ups, right? Instead of hoping a super busy nurse remembers to call a recovering patient, the AI autonomously calls to check on their recovery, confirm they're taking their meds, and identify any concerning symptoms early on. This kind of automated chronic disease monitoring has been shown to meaningfully reduce hospital readmissions. It's a system that doesn't just sit there waiting for the phone to ring, it actively reaches out to keep patients healthy.
So the crucial point is this. Healthcare is facing a massive administrative crisis that fundamentally distracts from clinical care. AI voice agents offer a proven, highly secure, and incredibly effective way to automate the repetitive tasks that burn out staff and frustrate patients. It forces every single healthcare provider out there to ask themselves a really hard question. Is your clinic actually treating patients, or are you just managing paperwork? Thank you so much for joining me for this explainer. I really hope it gave you a clear understanding of the incredible impact AI is having on healthcare communication today.